Thank you, Sahan sir, and all those participants in this session. Good morning, good afternoon, good evening. Welcome to the 1930th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute.
Dr.
Thank you,
Manoj,
welcome back. Today our guest is
I'm making you the host now.
Okay,
so
okay,
we'll
thank
be
you, sir.
changing. Yeah, so you can continue, sir.
Yes, thank you, sir.
Yeah, you are the host now.
Okay. So today our guest is Dr. RITU GUPTA, MD Homeopathy Associate Professor, Department of Hormone of Medicine and Deputy Medical Superintendent, Neminath Homeopathy Medical College and Hospital Research Center, Agra.
He has just joined.
Yes.
Make her the co-host.
Yes, sir. Yes, sir. Only just joined, sir. So today's topic is management of cerebrovascular hemorrhage with homeopathy. Very important topic. A lot of persons in around 50 years often suffering, especially after this post-COVID era, from these diseases. So the possibility of homeopathy must be explored and utilized by the persons who are suffering from this disease and those who are prone to suffer from the disease. So, Dr. Ritu Gupta, you can have the platform for the next 45 minutes. So, to please proceed, Ritu. Dr. Ritu, you can start now. Dr. Ritu, am I audible? Maybe some technical reasons. Yes, please proceed, Dr. Ritu.
Good evening, everyone.
Yes.
Very warm welcome to all. Myself, Dr. Ritu Gupta. I'm Associate Professor in Organ Department.
The introduction is already over. Please proceed.
So let us start with the case.
Yes, please.
Sure. So I hope.
Yes, visible. Yes.
Yes, visible. Okay. So let us start with the case. This is a case of subacute and subdural hemorrhage, and the lady was 65-year old. She came to hospital when many doctors in allopathic hospitals, she was denied to treat. So this was the video. अम्मा जी, क्या हुआ? क्या परेशानी हो रही है? अच्छा, अम्मा जी, क्या हुआ? क्या परेशानी हो रही है? कुछ परेशानी नहीं है। टेम्परेचर चेक करो कि ये ऐसी कब से हो रही है?
इनको एक हफ्ता जब ट्रीटमेंट चलाया था हाँ। उसके बाद से ऐसी है, इनको मूवमेंट नहीं आ रहा कुछ में। बच्चा जो ऐसा है उसने ले गया हाँ। 2 इंजेक्शन लगा दिए जी। इंजेक्शन लगा।
अम्मा जी, अम्मा, अच्छा आपकी मामी
हैं? हाँ।
So, the presenting complaint we did just got after observation, that was alternating state of consciousness and unconsciousness for last 1 week. On asking again and again, as everybody can see, that she was not replying anything, only she was saying that she is fine. So this was her lama, because they cannot afford that allopathic treatment, and as there was no surety even after surgery that she can survive. So they took lama from that hospital, and somebody told them about the hospital in that allopathic hospital. So they came here. History of present complaint was, on asking with the talking with the attendant, we got this, that 1 week ago she got headache and took painkillers. Next day she started feeling dull, drowsy, and she was hospitalized in any allopathic hospital. CT scan done, neurosurgeon advised for surgery. Condition was getting worse day by day, and her condition was deteriorating, and her consciousness was also altering. Sometimes she was unconscious and conscious. They went to FH Medical College. There the doctors refused her to get admit, as she was very serious condition. Someone suggested to go to Neminath Homeopathic Medical College, Hospital and Research Center, and next day they came to Neminath. And at that time, when she was admitted, her blood pressure was this. She was already catheterized when she was here in Neminath in the emergency department, and not responding to any stimuli. These tests they were carrying already with them. And this was the NCCT head. In this, we can see there was 55 mm of hematoma. So, I request everyone to make their own totality and let us discuss about what we can prescribe in this condition, where nobody have any kind of hope. Yes, we got one answer, that is pyrogenum, Arnica montana. So till now we have two answers. One is Arnica and the second is pyrogenum. Kindly write the totality also. I'm presenting this case as I was the intern when this patient came to hospital. So this was from very beginning. And I just admitted the patient and then I called sir. Sir was in a seminar in Pune, and sir said, if you have admit, then do yourself. You will do. Legacies, left side affection, and the opium. We have got three answers. 4. Pyrogenum, arnica, legacies, and yes, 3. Hematoma and answering then become unconscious. If anybody wants to see the previous slides, then I can go there, or we can wait for a while. Okay, so let us start with the case. What I have prescribed at that time, I just advise these tests in the hospital and proceed with the medicine, and the result of the investigation is on the screen. My totality was subdural hemorrhage or hematoma, unconsciousness alternating with consciousness, says no complaints with her, and hypertension was there. So the prescription was Arnica montana LM1, 1 globule, mix in 10 number globule in 100 ml aqua, and 10 downward strokes, 5 ml from the solution to be mixed in 1 cup of water and to be taken every 5 minutes. Then again with the second cup. So after the 8 doses, we can watch the reaction of patient and the observation of attendants. So as I'm talking about attendant, because the observation and cooperation of attendants is very important, because they are the person who are there 24/7 with the patient and they can guide you correctly what is going on.
बेटर लग रहा था तो आंखों में जब रहा है पलके जब भी वो चीनी दिख रही है
और
थोड़ा रिलैक्स दिखाई दे रहा है
चेहरे पे रिलैक्स,
पैरों में दर्द है
क्या मतलब मैं समझ नहीं पा रही हूँ कि क्या अंतर आप लोग को लग रहा है।
ज़्यादा पहले आंखें नहीं खोल पाते थे कुछ देर तक
अच्छा,
आंखें पीछे ना ऐसे गिर करके वो वाली आंखें नीचे रही है। अब संतुष्टि की आंखें खोल रही है जैसे
ओके
संतुष्टि की आंखें।
ठीक है।
और नींद भी जो आ रही है वो गहराई वाली नींद आ रही है, ये नहीं कि मतलब बेचैनी वाली नींद हो, वो नहीं आ रही।
उससे पहले
हाँ
जैसे बेहोशी पड़ा था ना वो चीनी दिख रही है
हाँ
ओके
वैसे पानी वगैरह ठंडा पानी दो मुझे, मतलब चाय की पूछ रहे हैं, नहीं नहीं मुझे नहीं पीनी चाय।
कुछ खाया?
नहीं नहीं।
So attendants was saying that she's getting up and sleeping again. Then I have confirmed ki what change they have felt, because she was previously also doing same thing, that talking and sleeping again. Then they were saying that now when she's awaking, at that time she opens her eyes for a longer period and talking and answering in a very relaxing way, not in that panic mode. And by the evening,
दर्द हो भैया
कितना दर्द है? अच्छा ठीक है, ऐसे ही लेगा। ठीक है, ऐसे कर दो। छूने में भी हो रहा है? ये वाला फोटो उसमें ज्यादा है।
पैर में
कौन से पैर में ज्यादा दर्द है? एक मिनट बंद कर दो। हो रही है? इसमें ज्यादा है? अच्छा ठीक है, एक आध दिन में बिल्कुल सही हो जाएगी। पर so by the evening of first day, she started moving her right hand and leg partially and have sensation in left hand in leg, because there is pain, so she has sensation now. So we continue with arnica LM1 second cup in the same way every 10 minutes, second cup dilute with second cup dilution. And next day in the morning she is much conscious. कैसी हो आप? पैरों का दर्द कुछ कम हुआ या नहीं? नहीं हुआ? कुछ खाओगी? कौन है ये आपके कौन है?
बहू के भैया।
बहू के भैया। अच्छा, पहचान रही है? नहीं तो आई साइट ठीक है? और ये कौन है आपकी?
ये
हाँ
मेरी बहू भी नंद है।
बहू कहाँ है आपकी? बहू तो she is trying to recognize but not recognizing the attendants. The lady is not her daughter-in-law and the male is not the brother of her daughter-in-law. As she do not have any child, so there are some other relatives. but she is not able to recognize in the morning, but she is better, she have better consciousness. So by the evening, if we see changes, day 2 at night,
क्या नाम है आपका? माया देवी। जीभ दिखाओ। कोई बात नहीं, कोई बात नहीं। खा लो, उसके बाद दिखा देना। वीडियो देखा तुमने? कुछ आराम है? कितना आराम समझे? चवन्नी वाला, ठीक है, बहुत अच्छा। ये वाला हाथ उठाओ। ठीक है, ये वाला पैर खींचो या उठाओ। सीधा करो, अच्छा कोई बात नहीं।
so she is not able to move the hand and leg left side as it is very painful, but she herself said to sir that she is feeling 25% better.
क्या?
So now sir increased the potency. Arnica LM2, 1 globule in 100 ml water and half hourly with the first cup dilution. Day 3.
ये वाला हाथ उठाओ।
Now she started moving her left
हो गया
hand
हाथ।
on the day 3.
सुबह तो उठ नहीं रहा।
So answering consciously, she is able to move her hand voluntarily on command. Now not relapsing to unconsciousness. So we continued with Arnica LM2 but increased the dilution of cup. So with second cup, half hourly. Day 4. I was asking her to move herself and stop the intern for support. We asked sir to give some support
ऐसे घूम जाओ।
as she was not able to move herself.
घूम जाओ, घूम जाओ।
And it is very painful to her. So, as we can see that the improvement is now, we cannot see the further improvement. That is why, sir, we have increased the potency to Arnica LM3 with first cup dilution, and the repetition was half hourly, 30 minutes, every 30 minutes. And day 9, she started walking on her own feet with light support, as she was severely osteoarthritic also. Even in that condition, she is able to walk. So Here we have increased the potency to arnica LM4 with first cup dilution on day 9, and this was the video of discharge on day 15. From stairs till down ground floor, she came on wheelchair because she can be tired. Now she said herself that I will go on my feet.
आगरा से डॉक्टर साहब मैंने बिल्कुल उनकी छोड़ दी थी, यहाँ पढ़ाई बंद में ठहरा हुआ हूँ। अच्छा, बिल्कुल भी छोड़ दी थी? बिल्कुल भी छोड़ दी थी, सिर्फ मरवे के नीचे घर ले गया था मैं। अरे बिल्कुल सही बता रहे हैं डॉक्टर साहब मैं। अच्छा, ये अब तो ठीक है? अब ठीक है। आपके सामने इन्हीं की वजह से बच गई। हाँ। आर के मिश्रा डॉक्टर में आगरा के कितने बड़े हैं? आरसी मिश्रा। हाँ, मुझे इतनी गुस्सा आई, मैं क्या बताऊं, बता नहीं सकता हूँ मैं। क्यों? नेट उन्होंने वो देखा वो। हाँ। ये। हाँ। इनका ऑपरेशन होगा। अच्छा। मैं डॉक्टर साहब और कोई कहीं और कुछ नहीं। ऑपरेशन ही होगा। ऑपरेशन होगा। वो बोला करे 1500 रुपए दे दो। 1500 रुपए दे, 1400 रुपए की दवाई ले दी। अच्छा। 3000 रुपए हो गए। 3 दिन के 38,000 रुपए नर्सिंग होम वाले लिए थे। अच्छा। 3 दिन के 38,000। 3 दिन के। फिर उसके बाद कोई कुछ नहीं, उसे जो कहेंगे भाई ले जाओ, आपको ऑपरेशन नहीं करा रहे तो यहाँ से ले जाओ। अच्छा। फिर तो मैंने चलो मैंने कोई दिख तो नहीं है, मुँह में से झाग निकल रही है, यहाँ आई थी तो मुँह में से झाग निकल रही थी। अच्छा। हाँ, बैठो बैठो। एफएच में क्या बिल्कुल खत्म कर दी थी। एफएच में क्या बोला? एफएच में बोला कि नहीं यहाँ नहीं, आगरा ले जाओ। अच्छा। एफएच से घर लौट गए। एफएच से घर से ले गए, घर चले गए। जो फिर एक ना बताया था उसी ने, वो हमारा साला यहाँ लाल पार टूला रहता। अच्छा। कि जीआई तुम ऐसा करना कि एक दफा माँ होते ना तुमने कहा कि मई में तू बता रहा, मैं कल एफएच में ले गया, मई से मैं दोबारा फिर ले आता मैंने कि हाँ क्या दिखा दो। तो फिर मैं तुमने यहाँ तुमने दिखाने यहाँ आया मैं इलावा, आप ये लोग देख लो नहीं क्या बोला उसने, नेमिनाथ ले जाओ। हाँ उसे नेमिनाथ ले जाओ। अच्छा। तो ये नया हॉस्पिटल बनाया है और मैं तो देखा भी नहीं तो देख रहा हूँ। अच्छा। एफएच मेडिकल कॉलेज ने मना कर दिया? हाँ वहाँ साहब मना कर दिया। अब कैसी हो अम्मा ये बता? सही, बिल्कुल ठीक हो? चल फिर पा रही हो? अब ऐसे चल रही हूँ, धीरे धीरे। खा पी रही हो? हाँ। लेटरिन आ रही है? हाँ। नली कितने दिन में निकल गई थी? नहीं मालूम। अच्छा। हमें क्या बात की नहीं मालूम। यहाँ पे कितना पैसा खर्च हो गया आपका? करीब 65,000 रुपए खत्म हो गए करीब। यहाँ पे कितना हुआ? यहाँ पर? हाँ। यहाँ पे तो हिसाब नहीं हुआ, यहाँ तो बहुत कम। बहुत कम? कम नहीं, बहुत कम। बहुत कम। अच्छा। खुश हो? यहाँ खर्ची क्या है? यहाँ कोई खर्च नहीं। कह रहा हूँ जितना खर्चा आप यहाँ कर लेते हो, हाँ, बस ज्यादा तो आप खाना ये देते हो मरीज के लिए। अच्छा। मैंने ये देखा। ठीक ठीक है, थैंक यू। मैंने ये देखा। मैंने संतुष्ट हो? हाँ बहुत ज्यादा। अम्मा संतुष्ट हो? ठीक है, चलिए।
So this can only be possible with homeopathy, that you can bring life in a vegetable. As we all can see, from vegetable state, she came to her feet and she is alive only in 15 days. And you can generate life in few seconds, few minutes also. So on day 15, she was discharged with arnica LM4, 20th cup. Whenever we saw that the improvement is not, we can see the further improvement, then we were increasing the cup. So on the day of discharge, it was 20th cup. And on this date, the scan was showing that there is complete resolution of the hematoma. When she came after 15 days for follow-up,
बैठ जाओ बाबा यहाँ पे।
कैसी हो?
सही है डॉक्टर।
he is her husband.
बिल्कुल ठीक हो?
बिल्कुल। तो जो पैरन से ही परेशान।
पैरन से तो पुरानी परेशानी है। पुरानी
Some network problems unfortunately happened. We can wait, I think. Yes, Dr. Ritu. Some network problems. Please unmute. You are muted. Please unmute.
Yes, sir. Some network issue was there.
Okay, no problem.
Just a second, sir. I'm
Okay.
resharing the slide.
Don't worry. Take your own time. No problem.
Thank you, sir. So, when she came on 15 August 2018, we can see that she's coming on her own feet, and hospital is 500 meter away from the main road where the rickshaws drop the patients. She came although from that place, and the complaint she was saying that she is not able to sit from the get up from the ground. It is due to her osteoarthritic issue, and within that much short span of time she don't have need to take antihypertensive also. So now we have increased the potency to arnica LM6 with first cup dilution, because she have to take care a lot at home to her mother-in-law. She also have her mother-in-law at home. So it will be very difficult to take medicine with 20th cup. So now we increase the potency and first cup dilution. In next follow-up on 30th August after 15 days.
अम्मा कैसी हो ये बताओ।
खूब अच्छी हुआ,
खूब अच्छी हो, बिल्कुल अच्छी हो।
बिल्कुल अच्छी।
कहाँ से चल के आई हो?
चौराहे
से। मतलब ये मानो यहाँ से 500 मीटर होगा, इतनी दूर से चल के आई हो। आराम से चल पाई? कोई दिक्कत नहीं है?
कोई दिक्कत नहीं।
अच्छा, सांस फूली? नहीं फूली। अच्छा, कोई चक्कर वगैरह?
कुछ नहीं।
कोई कमजोरी?
कुछ नहीं।
ठीक से खाना खा रही हो?
हाँ।
आप बताओ दादा कैसी है?
बिल्कुल सही है साहब,
हाँ,
कोई शिकायत वाली बात
कोई शिकायत नहीं है, एकदम बढ़िया चल रही है।
बिल्कुल साहब।
ये जो दवाई पीछे ले गए थे इससे काफी आराम है?
बहुत आराम मिला।
अच्छा, बहुत आराम मिला।
चल भी तो जाई दवाई से।
अच्छा, जो दवाई आपको बाद में दी थी इससे चलने लगी?
इसी से
जो
चलने
पिछली बार बता रही थी कमर में दर्द रहता है और पैरों में दर्द है, वो सब ठीक हो गया?
सब सही है।
अच्छा, चलिए बहुत अच्छा है। मतलब पिछली वाली दवाई से बहुत अच्छी हो। अभी क्या कहना चाहोगी?
अब अब चल रही हूँ तो देख अच्छी तरह और
चल उठूं। अच्छा, पहले से ताकत कितनी आई है शरीर में?
हाँ, सो तो
ताकत आ गई है।
बैठे से उठो नहीं जाते सो अब
उठ लेती हैं। और चल फिर भी खूब रही हैं। कमर का दर्द नहीं है, बंद हो गया बिल्कुल। ठीक है।
So now we have increased the potency further, as with the arnica only, her osteoarthritis is also improving. Now she is able to get up from the floor also. No backache, no shortness of breath, and all over she is much better. And in the after so long, in another follow-up.
आइए बैठो दादा। नमस्ते। कैसी हो अम्मा जी?
अब तो ठीक है।
ठीक हो?
हाँ।
बिल्कुल ठीक हो? आप बताओ दादा। सही है, बिल्कुल बढ़िया चल रही है। अच्छा, आज कैसे आना हुआ? दिखाने आई है? कोई परेशानी है? दवा लेने आए हैं। ठीक चल रहा है सब कुछ? एकदम खूब चल रही हो, फिर रही हो, खा रही हो, पी रही हो, कोई परेशानी नहीं? ब्लड प्रेशर कैसा रहता है? सही है। कोई ब्लड प्रेशर दवाई खानी पड़ रही है?
नहीं।
कोई अंग्रेजी दवाई तो नहीं खा रही? कुछ नहीं, यही दवाई चल रही है। अच्छा, जैसे आप चल नहीं पाती थी, सांस फूलती थी चलने में, वो कैसी है? अब नहीं चल पा रही हैं? अच्छा, घर का काम कर पाती हैं? खाना बना रही खुद? अरे वाह, चलिए बहुत अच्छा। सब ठीक चल रहा है? ठीक।
This is what we called as highest ideal of cure and permanent restoration of health, complete well-being, despite of increasing age, looking more healthy than the spouse. The case opens a new horizon for further research and efficacy of constitutional remedy in geriatric. So, where nobody have any kind of hope, then homeopathy brings hope. And it is very effective we can see when everybody denies for surgery also, where there is no chance for surgery, even then we can give lives. So now we prescribed Arnica LM10, third cup, twice a day. Thank you so much. So this was the case, and I prescribed Arnica because in Ellen's keynote, in very first day of first year, sir have taught us that if there is any kind of injury, either it is mental, physical, or emotional, we should once think of Arnica. And in Arnica, if we see, it is clearly mentioned that mechanical injuries, traumatic affections of muscles, concussions, and there is a symptom that in Arnica montana, patient, when you will ask the patient what are the complaints, they will say that everything is all right. I'm completely fine. In Hindi, they will say कोई परेशानी नहीं है, हम पूरी तरह ठीक हैं. So the same thing patient was answering to me, and there are many medicines, as many doctors replied, that on the basis of consciousness to unconsciousness, opium, and there are many other medicines also. But I chose Arnica because what she said, she's coming to consciousness and answering and then going back to unconsciousness. But what she said in that time period, once what is being asked, she answered correctly. Another, that she said that she is completely fine, and that there is hematoma. And another one, I have examined her from here to here, and it is also mentioned in Ellen's or in Arnica that heat of upper part of body and coldness of lower. So it upper is head, or lower you can see the nose, back, dorsum of hand and dorsum of feet. Wherever we go from upward to downward, the temperature will be reducing. On these symptoms, I prescribed Arnica, and the result in front of us. Thank you so much. If there is any query, we can discuss.
Yes, thank you, Dr. Ritu. Nice presentation. And also commendable on it is up to the common man and the medical world. It is up to them to decide what is more effective for them. Because we all know that the medicines, it can cross the blood-brain barrier, is also homeopathic medicines because of the potentized nature. Moreover, we can select according to the presentation of the case. Not only stroke, but when the patient is ill, he always says, I'm well. That's another indication of this Arnica. Anyway, nice presentation. It's time for discussion. Those who would like to participate, please raise your hand. Sridhar Krup sir, are you there? Sridhar Krup sir, have you heard this case? And please make your comments. Sridhar Krup sir, are you there? Yes, of course. He's the always ever ready person to respond. Sir, please unmute. Yes, sir.
Yes.
Director, sir, please.
Yes, it was an excellent session. Thank you, Dr. RITU GUPTA. Come again with such wonderful cases. I got so much experience with the Gupta, the Arnica, regarding injury. That mainly that so many cases I got so many cases result with Arnica with 0/3, 0/6. I am not using in 1, 2, 3 like that, 6, 3, not only up to that much I used. That I got very good result. Especially the first I got a case while I was serving in Punjab as a lecturer and the RMO. One midnight, one army general came that while he was lifting some weight, it fell in his leg and he came in the midnight. I was the RMO of the college in Abohat, Punjab. Then midnight, that awake and he took some analgesics, so many other things, but it couldn't get relief. In early morning, 5 o'clock, he came. I gave arnica 0/3. Then within 1 day itself, what relief. But again, it is not subsided completely. I gave 0/6. Then within 1 week, it is completely disappeared. He was the army, the chief. So every Christmas and every Onam, he was inviting me and for that the food. So like that of so many cases, I was able to get good result with arnica. It is a wonderful remedy in our materia medica. Really, from to the time of Hanuman itself, it was using very fantastically. That I like to say. Anyway, it is a wonderful case. Keep it up. That there is no equivalent to our medicine, no any other medicine in other system of medicine. We can cure so many so-called incurable cases. Thank you very much. Wish you all the best. So our arnica is one of the essential medicine for injury in our materia medica. Thank you very much. Especially ear pain, oversensitiveness, such times it is very useful. Even the patient cannot sleep even due to the pain. It can be cured. Thank you very much for inviting me.
Yes, sir.
Thank you.
Well, Saihila is a complimentary of arnica in some cases, definitely. Time for discussion. Anybody would like to participate, you can add and you have your own versions. Please raise your hand. Without proper discussions and deliberations, these types of program will not be complete. So please raise your hand, those who like to participate. Dr. Ritu, what about the total duration of the case? How much days it took?
She was completely fine within a month, and thereafter she came for follow-up till 2019. And gradually we have reduced the repetition. After 2-3 months, it was 3 times, then 2 times. At the end, we were giving 2 times. Then they came for, her husband came for some other person's treatment, not for her. Then he told that she's fine, she's doing well, in that manner. But she was fine, so they didn't came back for her.
Yes. What about the blood pressure in these days, recent days?
It was completely fine. They don't need to take any antihypertensive.
Yes, that's good.
After that.
So I think
so as sir taught us since very beginning that in homeopathy, nothing is acute and nothing is chronic. It's the person who needs medicine, and medicine acts unconditionally, whether it is condition acute and chronic. It is our perception. We are taking it as a chronic disease or acute disease. But we cannot say that medicine is acute or medicine is chronic. So medicine acts unconditionally, whatever the condition is, irrespective of the totality we are taking. The prescription totality is, if it is correct, then it will bound to act. Whatever the case is.
Yes, 4 conditions are there. You must remember the medicine, dose, potency, and attenuation. These are the 4 conditions. It's not unconditional. Medicine, dose, potency, and attenuation. Then apart from all these things, we must be very conscious about the general management of the case. Then including the diet and regimen. In some power supply failure once again. Yes, I think electricity problem is there. Am I right?
Yes, sir. A bit of.
Okay.
Today it is only going on.
Okay. The nervous system of the electricity is the nervous system of the Zoom program. like the network. Then I think, do you have any special centers of the neurological cases in their college or hospital? Please unmute. You are muted now.
So pardon the question.
Do you have any specialized centers, treatment centers for the neurological these cases in your college? Special ward?
Specialized.
Yes.
So we treat here every kind of neurological cases, and we have very good results with the LM potency also. And actually, patient in homeopathy, they used to come at the end when they lose the hope from everywhere.
Why? That's the most important question. Why?
So why?
Why? That's the question.
Because they don't have awareness about homeopathy.
Again, why?
Because
Again, why?
everybody used to say homeopathy works very slowly. This is a myth. And this
No. That should be corrected, because
Yes.
we don't have such large facilities. Centers are not there. We don't have special courses. We don't have
Yes.
qualified hands are not there. So all these things together making a picture that there must first depend allopathy.
Yes.
If they deny the case, or they say there's no scope, naturally the patient will seek homeopathy.
Yeah.
So it
Now
is
they
up to
think
us.
of
It is up to us. The National Homeopathy Council and others should
Yes.
bring new courses, the fellowship courses, certificate courses, or the this DM courses in neurology in homeopathy.
Actually, it is on the homeopathy also.
Pardon?
It is also depending on. I have seen that homeopaths, they used to say that homeopathy, it is an emergency condition, so you should move towards. So, firstly, that homeopaths should be so empowered in themselves that they should trust their own system of medicine. Until or unless we will have trust and strong belief in our system, patient will not have.
So it often comes from this experience. That's the main
Yes.
problem. Trust often comes from experience. From where we get this experience? That's the question. So
Yes.
that's why I'm suggesting each and every college should start this handling emergency cases. And
Yes.
emergency management is an important thing.
Definitely.
But that was not happening, and we all know that some Russian doctors are there. They are regularly treating emergency case homeopathy medicines. Then the ambulance doctors are there. They are also using homeopathy medicines.
Yes, in India also, sir, many allopathic doctors are using homeopathic medicines.
But what is more important is we must legitimize it by starting courses
Yes, sir.
in our college. Now, Sridhar, sir, sir, please unmute now, sir. Yes, please.
I like to ask one question.
Yes, sir, please.
Whether it is possible?
Yes, sir, of course.
Hello.
Yes, please,
Dr.
sir.
RITU GUPTA.
Yes,
Audible?
sir. Yes, sir.
Audible?
Yes, sir, you are audible, sir.
Yes, it is. It is one of the best remedy during the time of delivery, before or after, even during also. What about your opinion about during delivery time regarding arnica? You got any experience?
Yes, sir. When I was in my internship or in my third year or in my second year, I have seen many cases in the hospital when we have prescribed many homeopathic remedies where as arnica, and even after the patients who had surgery, we prescribed arnica to the mother and to the child also. We have seen fast recovery in those patients where we prescribed our homeopathic medicine, and in comparison to the patients to whom we don't prescribe homeopathic medicine, where we prescribed Cyclac.
Yes. Yes, thank you very much. It is one of the best remedy
Yes.
before delivery, even during the delivery and after delivery.
After also.
Also, it is
So,
very one of the best remedy.
yes.
Thank you very much.
Yes.
I like to
But-
ask because
So,
it is not for me,
so-
but for the audience that I am
yes.
asking.
Yes, sir. Definitely. You are always welcome. Now, Dr. Bob Lim. Are you
So
there,
we
Dr.
would
Bob Lim? Yes, Dr. Bob Lim, please. Your comments.
Yeah,
Malaysia, please. Yes.
I'd like to congratulate Dr. Gupta,
Ritu
Ritu
Gupta. Yeah.
Gupta, for a very good presentation. And, she has a video and a picture represent 1,000 words. I have nothing much to add. She has covered almost everything. And she's specifically mentioned about the Allen's keynotes for Anika. And she did it very well for this patient. And it is also a very good thing for homeopathy. And we want to have more of this case sharing for evidence-based homeopathy treatment, especially for difficult and impossible cases. And also I'd like to mention that she mentioned the specific Anika symptom where the upper body is hot and the lower is cold. And that is specific for Anika, especially when the forehead is warm and the chin below is cold. That is also specific for Anika. And I like to say that she did extremely well with the LM potency. And we hope that she can share, Dr. Ritu Gupta can share with us more on the LM potency and how she go about it, because it is not a common thing for us to prescribe LM potency. So I hope that you can share with us in the near future how you come about
Sure,
this.
sir. Definitely.
Thank you very much. And more case
Thank you,
taking.
sir.
Thank you very much. Over to you, Dr. Manoj.
So I
Yes.
have a few patient,
Yes,
emergency
please.
patients. So may I take the lead?
Oh, yes. Because
Thank you,
my
sir.
and only mission of the physician is to. Yes, okay.
Yes,
Definitely.
sir.
Okay.
So some intern came to tell me that there is an emergency case. So
Yes.
that is why I'm taking.
Okay, on behalf of IFPH, I'm expressing sincere thanks.
Thank
Dr.
you so
Ritu.
much.
Thank you. Okay. Yes. Here are some. Yes, definitely you can leave now, doctor. Yes.
Thank you so much, sir.
So some questions, some the chat box, hematoma and answering, and then become unconscious. One of the symptoms of arnica. Then that's a question, but the patient left. Doctor is not there now. If anybody is there to give some insights or your experience in this case of the management of the cerebrovascular accidents with homeopathic medicines, you can unmute and you can share your opinion. Dr. Harikumar, are you there? Dr. Harikumar, are you there? Dr. Tanesh. Dr. Tanesh, please unmute.
Good evening, all. And cerebrovascular accidents are quite common nowadays, but unfortunately, people believe that it is due to the so-called clotting, but there are many reasons behind it. Actually, the young generation people are getting the so-called problems due to this disease. Cerebrovascular accidents, and vaccine has a big role in it. And we have a lot of medicine. The first medicine you can think about is, of course, arnica. The second can be protragus purulus. The third can be lactasis, and we can use all those things according as per the requirement and as per the uh, symptoms present by the patient at the time of presentation. This is what I would like to add. And I still remember a case, but that was some years back, some 20 years back, I think. A patient came with some problem, and she was talking in a different way, and the bystanders told me that the doctor, she visited the temple in the morning, and thereafter she is talking like this, and we could not identify what is the problem. She has some mental stress or something that happened after visiting the temple. But because of that, I thought that it was stramonium, that may be the medicine. And so I just gave her stramonium. But what happened was that, after reaching home, she developed a little bit of symptoms of hemiplegia. So immediately they took to the hospital, and where they found that then some cerebrovascular accident has happened in her brain, and it was because of that the patient was talking like that. So I don't think that all these symptoms are due to mental ailments, but the mental ailments can be a product of so-called, it can be a forerunner for a particular disease. So in during people also usually come to us and say that, doctor, she is always talking like this, and she may develop always this hypernatremia, so-called sodium deficiency. So of course we can have the same symptoms can happen during this cerebrovascular this hypernatremia or sodium deficiency. But there also we need to look into other aspects. Most of the patients who are coming with the sodium deficiency are usually taking more medications from the other side, and that may be the big problem for that, big cause for that. So this is what I would like to add from my side.
Yes, definitely the hyponatremia is a major condition, often imitating or mimicking this cerebrovascular accident, very closely running. And often the physicians as well as the doctors get confused. What is the actual cause? So we must be very, very cautious about arrive a conclusion that is a cerebrovascular accident. Then moreover, the clinical skill of the physician is very important. Unfortunately, that is depleting because it is always depending on this mechanical device or the electronic devices for diagnosing the case. The clinical diagnosis is not at all there, and the medical students are not at all equipped for studying properly. The clinical medicine is not there. So what is more needed is a clear-cut knowledge regarding the clinical medicine and its application. Moreover, therapeutics. We must be more competent to use medicines. Not only arnica, but caustic is another medicine. Plumbamate, Rastox is there. So many, the Armet is another medicine. Then the Bothrops, the Naja, so many medicines are there regarding the blood clot. And moreover, the vaccinosis, the effects of these vaccines, that must be studied in such cases. A lot of persons in the recent days are suffering from this massive hemorrhages, then heart attacks, then the myocarditis, all this happening as a result of the vaccines. It is often considered as vaccine is the giant killer there. And I think these are the things we must study, and definitely what is more needed is homeopathy is capable of doing all these things, but we must be equipped with our medicines. We have enough medicines. Around 8,000 medicines in homeopathy recently. But how many of us or how much of us are using? Only 60 or 70 medicine the most. Others are not there. So more comprehensive study is needed. The ignited minds are needed. More courses should be started instead of colleges. And then we must be able to compete with the need of the hour. The time will conclude the session. May I invite Dr. Tanesh to express word of thanks. Dr. Tanesh, please. The Tanesh doctor is not there. Dr. Tanesh, are you there? Because Tanesh doctor is an integral part of this
Yes,
class. 1,938 days. Dr. Tanesh, please.
yes. Thank you, Dr. Manoj. And it was really a very good session. Unfortunately, I couldn't join due to some technical problem with my network. And I was joined a little bit late. And what I heard from the beginning was that it's a very good session. A lot of people, students, and doctors joined in this session. And everybody really enjoyed the session because it was really a fantastic session, and that's what I would like to say about this session. And this kind of presentations are really needed to motivate homeopaths, not only the junior homeopaths, but even senior booksellers also need such kind of presentations that will motivate them to study more and more about our homeopathic material medica and how to deal with patients and what are the deficiency we have in our knowledge that can also be corrected by this kind of presentations. Anyway, I am thanking Dr. RITU GUPTA and those who participated in the session in this evening, and particularly congratulations to Dr. Manoj for bringing such a wonderful session, worthwhile for all. And your comments are also excellent, and your moderation are superb. And with that, I thank all of you once again.
Yes. Well, that's all for today's English edition. Hope you that will be back again tomorrow. Till then, goodbye, and over to Dr. Shaila to continue the program in Malayalam.